Today, we learned that we have experienced the first COVID-19 death in North Adams. We also learned of a significant increase in COVID-19 cases in Berkshire County, including a number at the Williamstown Commons nursing home. I want to begin by offering my sympathy to the family and friends of our fellow North Adams resident at this time of loss, sadness, and concern. I offer these words that will be familiar to those who share my Catholic faith, but which I hope will resonate with everyone today. May perpetual light shine on them. And may it shine on all of us, especially now as this loss has reached our community and the path ahead of us may feel unclear. The situation at Williamstown Commons is also a reminder and a wake-up call that we are not immune to the risk and the threat of COVID-19. I offer my support, gratitude, and admiration to the dedicated staff at the Commons. I also offer my sympathy and concern for those who are suffering with the novel coronavirus, and to the loved ones of the people in our nursing homes and extended care facilities who cannot be there with friends and relatives when they may need them most. This situation makes us realize that the virus moves faster than our testing capacity, our data reporting, the ability of our healthcare system to keep up, and our response plans. That means there's a lot we don't know. I want to tell you a few things we do know right now. This will get worse before it gets better. As our testing capability and our data reporting capacity improves, the number of cases will increase. The governor has been saying this for the past week, and now we know for sure that it is true for northern Berkshire County. We will continue to learn just how close to home COVID-19 can hit. We will experience more loss, and with it, more concern, fear, and uncertainty. We will remain isolated from family, friends, and loved ones at a time when they need us most. Vulnerable members of our community will struggle with increased feelings of isolation or anxiety and concerns about their well-being. Our students will remain cut off from their classrooms, and our professional educators from their calling to guide students as they learn and explore their vast potential. We will struggle, like every community, for the equipment and materials we need to treat those in need, and we will advocate tirelessly to protect those on the front lines of our healthcare system. That's hard news, but it's the reality we all must face. And I'm here to tell you there's hopeful news as well. Because I know we have an experienced, dedicated, talented team working with us in North Adams, in Northern Berkshire, and in the Northern Berkshire Operations Center. We and they acted quickly to set up a regional response team, and we truly have a model operation in place among our 8 Northern Berkshire communities. This command structure and collaborative approach is one of the things that's going to help us respond as the novel coronavirus hits harder, strikes deeper, and challenges all of us more. And the community outreach team built into the operations center is helping to keep people connected, to understand needs, and to provide support. I know it's easy to feel helpless with so much changing so rapidly and so much uncertainty and so many concerns throughout our community. And when we feel helpless, we have a natural tendency to want to act. I understand that, and I'm grateful to all of you for it. Our ability and tradition of working together and supporting one another truly is one of the strengths of North Adams and the Northern Berkshires, and it will sustain us during this current crisis and during the long recovery ahead. So what can each of us do? First and foremost, and I cannot stress this enough, continue to practice social distancing. In fact, please step up the practice of social distancing to a new level. I know it's a sacrifice, but it is for a greater good, the health and safety of your loved ones and mine. If you don't need to go out, don't go out. And specifically, please stay away from city parks and playgrounds. Public gatherings of more than 10 people in unenclosed outdoor spaces are not recommended and are only allowed if individuals practice social distancing. Athletic activities involving close physical contact are prohibited. Playground equipment, basketball courts, and the skate park are closed and should not be used until further notice. And please, I ask you, now is not the time to look for a loophole or an exception to this policy, or to challenge the authorities working to enforce it. Experience in other parts of the world have already demonstrated that effective social distancing helps to combat the spread of COVID-19. That's why I implore everyone to play their part in preventing the spread of this virus. Doing so will protect our healthcare system, our frontline responders, and our neighbors, friends, and family members. It's hard. I know it's hard. But this is for everyone's safety and for our community. At the same time, please look out for your friends, neighbors, and family members. Maintaining healthy connections and well-being is even more important now as we practice the physical distancing that we need to contain the spread of COVID-19. Restrict your travel to essential activities. If you are traveling or visiting Massachusetts or the Northern Berkshires, follow the governor's advice and self-isolate for 14 days upon arrival. I encourage you to take time each day to reach out to friends, family, and neighbors, and to let people know that they are seen and that people care. If you or someone you know is struggling with feelings of isolation or anxiety, or if you have concerns for their well-being, please reach out to help. The Northern Berkshire Operations Center has liaisons available to connect people with resources and service providers throughout the community. Call 413-662-3614 or email nbcovid@gmail.com for assistance. I want to thank everyone for doing their part to ensure our friends, family members, and neighbors feel connected and safe. Please do what you can to support local businesses, especially those that are engaged in essential operations under the governor's order. In particular, and if you are able, please support local bars and restaurants that are providing takeout and delivery service. The economic impact of COVID-19 will be as severe and will cut as deeply as the medical and healthcare concerns. And we want to do everything we can to help our local businesses remain strong and to recover when this crisis has passed. Again, today is a day of shared loss for our community. We have to prepare for greater losses and deeper sorrow that will challenge our resolve, strain our empathy, and tax our resources. Our job as individuals and community members is to stay strong and resilient and to lend our strength to others where and when we can. Each of us must accept our responsibility of shared sacrifice to protect our healthcare system, our healthcare workforce, our first responders, and our community by continuing to do everything we can to flatten the curve of COVID-19. I know we have the people, the resources, the talent, and the will to face this challenge, and I thank everyone for doing their part. With that, I'll turn it over to Jay Green, the town administrator from the town of Adams. Thank you.
Thank you, Mayor. Good evening. In the last 24 hours, the town of Adams has received feedback from our constituency, our citizens, as well as our police department and Department of Inspectional Services that there were large gatherings in the public parks of the town of Adams. Although town officials made an effort early on to refrain from having to restrict public park usage, unlike the city of North Adams, which took these steps last Friday, we're now forced in the town to take those steps. Effective immediately, all parks within the town of Adams are closed. Our police department, Department of Inspectional Services, and the Board of Health will be watching and monitoring. This is not a step that any of us wanted to have to take, but we cannot take a risk and allow for this disease to spread farther and faster simply because we wanted people to use our parks. This is a difficult balance, a difficult time for us to make these decisions, and we're doing so fully in the interest of public safety and public health. As the mayor spoke about this evening, our first responders are working around the clock we're seeing on the municipal side an increased amount of questions, inquiries, as well as other resource usage from the municipalities. And we are only at the beginning of this. We need your help. On behalf of the municipalities here that are represented in our command center, we're asking you tonight to please heed the advice given by the Centers for Disease Control, by the Massachusetts Department of Public Health, the governor's office, and your local government. Please physically distance, stay home, avoid large gatherings. Do not use a cavalier attitude at this time. This virus will spread, and no one is immune to it. With that, I'd like to thank our constituents in the town of Adams for observing and being concerned about the public safety of their own neighbors. This is not a time to be concerned with self-interest in as much as we have to look out for each other. So on behalf of all the municipalities here, we'd like to thank our first responders and our medical teams who are starting to ramp up and gear up. And with their guidance, with their leadership, and with your participation at home, we'll get through this. Of course, our command center here is working steadfast and trying to allocate resources, coordinate resources. And in order to give us an update, I'm going to turn it over to Malio Jacino, our director here at the EOC.
Thank you. Good evening. On behalf of the Operations Center, our sincere condolences to our family here in North Adams that has experienced their recent loss, and to the many other families that are experiencing the complications that go with being involved with the COVID-19. As stated, we have the Operations Center here that is in operation from 8 a.m. to 5 p.m. Monday through Friday. We have some additional staff that's here on Saturday and Sunday periodically. The number here, 413-662-3614, that's able to be contacted during those primary business hours. However, we also have the email of nbcovid@gmail.com, which is monitored 24 hours a day, 7 days a week. I want to talk briefly, before I get into what the week's operations look like, about an important topic, one being isolation, the other one being quarantine. There seems to be some confusion, some concern, and some reaction amongst the communities when they hear that somebody may have self-quarantined or been quarantined or someone's in isolation, and then they may see them out on the streets. To be clear, a quarantine is something that somebody does when taken out of the general population, either by their own desire, based on the information from the CDC or their local community, or a recommendation by CDC based on potential contact or being in the area of somebody with COVID-19. That quarantine, the number that we keep hearing is 14 days. You remove yourself from the general population, but you could find yourself in your home with your family. We would request for limits of your family contact at that time, such as any hugging or, kissing your loved ones, to refrain from that type of activity. But you could still be in their presence with social distancing still occurring even in your own home. That being said, you would also monitor your fever twice a day or more and determine if you're symptomatic or asymptomatic. The bigger difference with the quarantine and isolation is during quarantine time, after that 14 days, you can return to your normal activity and go back and be in the general public or back in the workplace. Isolation is a little different. And now we're seeing more isolation as we see the numbers increase of COVID-19. This is a confirmed positive testing. This is called complete separation, even amongst your own family. It means that you may be isolated to one room of your home with resources and support at the doorway, and you able to be provided that, or in the event that you needed additional support, that would have to take place with a complete coverage of personal protective equipment, meaning a gown, a mask, a face shield, and gloves. There's also steps for release when it comes to isolation. You just don't, after 14 days, return back to general population. Initially, there was a dual testing process that needed to occur, which we don't need anymore. We're seeing more of 3 days being asymptomatic after that 14 days or after you're feeling better. That may be the trigger. Maybe you're sick for a little bit longer. But if you show minimal symptoms after that 14 days and you show no symptoms for 3 days and no fever with no medication, then you may be considered removed from that isolation. And please know that there's a public health nurse that monitors that and determines if you go back into general population. This is how we have to stop the spread. These are the drastic measures that need to be taken. Uncomfortable, yes. Not anything that we're familiar with, but certainly something we can get through. With that, I want to provide you a little overview of what it's like here at the Operations Center on a daily basis. We begin our days of people coming in approximately anytime between 7 and 7:30. We open up for business at 8 o'clock. There's a limited amount of staff here. This is a complete lockdown facility. The doors are locked, there's alarms in place, and anybody that does need to come here has to be through invite or allowed through messaging via email or phone call. Once it's determined that you are needed here at this facility, you are then screened at the door. You have to wash your hands and you have to register. And once you're in, the work begins. There's separate offices, there's different locations, there's an eating area, but the work begins. Emails, phone calls, working with many, many different communities. So right now we're working with 8 communities. In addition to that, working with MCLA and Williams College. Very, very important to maintain those relationships. We have conference calls at 12, 1, 2, and 3. You can imagine that gets a little daunting throughout the day. This week, we communicated with our senior delegation regarding the concerns for PPE and the lack of that within the communities that we represent. We know that Massachusetts government, MEMA, all of the individuals that we work with want to provide us all the PPE and the protection that is needed for our responders. It is just not available at this time. We did receive some hand sanitizer, and that has been distributed to the 8-9 communities that we're working with. We've established some new communication processes with the 8 towns, including MCLA and Williams. So they get communication daily on different updates via email, phone call, and we also use an application platform for emergency management. We were also able to secure a public health nurse for the towns of Savoy, New Ashford, and Florida. There is a public health alliance that has these nurses available during these times. Well, throughout the years, their need may have been not as great as it is now. And towns didn't even know that they didn't have a nurse representative for the state, or they did, and they just weren't able to secure one for whatever reason. The Public Health Alliance has been gracious in their efforts and said that there's a small fee. We will waive that because we want to make sure that those towns are covered. Through this operational center, we were able to communicate with Savoy, New Ashford, and Florida, get confirmation of their participation, and make that connection with those Berkshire Health Alliance nurses. And now there is no town uncovered within our operational center. We have a great working relationship. This is a difficult time, as the mayor and everyone has stated, but we need to remain united. I always tell people in emergency management in the years that I've done this is that we always need to be bigger than our problem. And that doesn't mean at the time of the problem. That means in our planning, in our preparedness, in our mitigation. And we can be bigger than this problem, and we are. This too shall pass, as we've heard. You know what? Something that's really touched me over the last few weeks is how many families are working with their children, and we have police officers in the community that are reading live on Facebook and providing information, things of support for children. The children are really incredibly important to us. So I have a little challenge for all the children out there today. All those things that you're coloring, all those signs of hope, those smiling faces, I challenge every household in our Northern Berkshire community to create those signs of hope for our emergency responders, for the families that are dealing with the COVID-19, for our elected officials, for our senior government officials, and place them in the windows throughout our entire community. I want to drive home after work, and I want to see colorful signs. I want the people that are doing social distancing and walking down the streets or going for a hike and on their way there being able to see messages of hope, messages of positiveness, messages of joy and unification. And I'm going to leave everybody on that note. And I want everybody to know that we're united in this fight, and we will win. as long as we stay positive and united. Good night, and thank you.